My name is Steve Hastings, I'm a GP in Stockport. I work at Hulme Hall Medical Group, I'm one of the 5 partners. We're a large practice, about 11,000 patients who are keen to use online services. The biggest thing that we've noticed is how little impact it's had on our day-to-day practice. It was that fear of the unknown, but now we've turned on the option for patients to view their records. It's been remarkably easy. As long as you have the systems and the processes in place, particularly at the beginning, then as GPs, we've had remarkably little hassle. When we first started offering records access, we trialled it with our patient group, 20 patients. They immediately went off and viewed their medical records, and within moments they'd come back asking us queries about their records, challenging us a little bit about what codes were, whether the codes were correct. So patients do generally immediately have a look at their records. They can't alter their records themselves. They would have to come back to us, and then we would have a discussion about whether a code is correct or incorrect. Sometimes they've forgotten that they have a particular condition, and sometimes we've made a mistake on their records, and what they've pointed out to us is quite correct. They will screen all the records, and that's part of sharing the workload, but also a sort of a learning experience for doctors, because they have to be aware that patients are accessing their records and the implications from that. One of the big advantages for patients for having records access is to be aware of what conditions they actually have, and therefore they would be able to research those conditions, become much more knowledgeable about them, and take a little bit of control for those conditions and the monitoring of those conditions. One of the surprising benefits for us as a practice for patients having online access is of improving our record keeping. So we are now very conscious that our records are accurate, that there aren't spelling and grammar mistakes, and that we're recording codes accurately, because if we make a mistake, patients will be very quick to come back to us and say that wasn't what my recollection was of that consultation. There's a fundamental mismatch between patients who see their medical records as their medical records and doctors who see the medical records as theirs in which to record their thoughts and their plans for the future, and those two are often separate ideas. And so allowing records access has allowed us to sort of blend those two together so that we're recording accurate information, but the patients also are taking ownership of their medical records. So it helps to sort of produce a more cohesive management plan for patients. There are always concerns about online security. The records access is heavily protected with passwords. It can be turned off at any point if we've any concerns that records are being inappropriately accessed, and that forms part of our patient information leaflet that we give out at the beginning of the process.